This is a story about a substance that was invented to save lives, and now ends more of them than any other drug in America. When it first appeared, it was hailed as a medical miracle, a painkiller so powerful and so precise that it transformed surgery and gave dignity to the dying. Today, that exact same drug kills tens of thousands of people a year, and a dose smaller than a pinch of salt is enough to stop your heart. Most of its victims never even meant to take it. This is the story of fentanyl. How one of the greatest gifts modern medicine ever produced became the deadliest drug the country has ever seen. It begins, like many of these stories, with a brilliant scientist trying to do good. In the late 1950s, a Belgian doctor and chemist named Paul Janssen set out to build a better painkiller. Morphine, the standard at the time, was effective but slow and came with heavy side effects. Janssen engineered a brand new synthetic molecule, and in 1960 he created fentanyl. It was unlike anything before it. It worked in minutes, and it was staggeringly powerful, roughly 50 to 100 times stronger than morphine. Handled correctly, that power was a gift. And for decades, that's exactly what fentanyl was, a genuine miracle of medicine. Its speed and strength made it a revolutionary tool for anesthesia. It let surgeons safely put patients under through operations that had once been far riskier. It became a lifeline for people in severe, chronic agony. Cancer patients, the terminally ill, delivered carefully through skin patches and lozenges to give comfort in their hardest days. Used the way it was designed, fentanyl relieved an incredible amount of human suffering. For a long time, this was the whole story, a powerful drug doing exactly the good it was built to do. To understand how it all went wrong, we have to back up to the bigger picture, the opioid crisis. Starting in the 1990s, American medicine began prescribing powerful opioid painkillers on an enormous scale. Drug companies aggressively marketed these pills, while downplaying how addictive they really were. Millions of people were prescribed opioids for ordinary pain, and a huge number became dependent. It created a vast population of people caught in addiction, a tragedy seeded in large part by corporate greed and misleading claims about safety. This was the tinder. Fentanyl would become the spark. Eventually, authorities recognized the disaster and began cracking down, making prescription opioids harder to get. But here's the cruel problem with addiction. Cutting off the supply doesn't cut off the need. Millions were already dependent, and when the pills dried up, many turned to the black market. First to heroin, which was cheaper and available on the street. A massive, desperate demand for opioids now existed outside anyone's control. And into that unregulated market, something new and far more dangerous was about to arrive. That something was illicitly manufactured fentanyl. Around the mid-2010s, criminal drug operations made a coldly logical discovery. Because fentanyl is fully synthetic, cooked from chemicals rather than grown as a crop, it is astonishingly cheap and easy to produce. And because it's so potent, a tiny, easily smuggled amount can be stretched into an enormous number of doses. For a drug dealer, it was the perfect product, cheaper, stronger, and easier to move than heroin. So they began mixing it into the drug supply. And that decision would kill people on a scale almost impossible to imagine. Here is the most dangerous thing about the fentanyl crisis. Most people who die from it never knew they were taking it. Dealers cut it into heroin and other street drugs to boost potency cheaply. Even more frighteningly, they press it into counterfeit pills, fake versions of prescription medicines that look absolutely identical to the real thing. Someone thinks they're taking a normal pill, and instead they're swallowing a lethal dose of fentanyl. There's no taste, no warning, no way to tell by looking. The person has no idea the substance about to kill them is even in their hand. And it takes so little. Fentanyl is so potent that just a few milligrams can be a fatal dose. An amount you could barely see, comparable to a few grains of salt. Now combine that with how it's made on the street, mixed by hand with no quality control. The fentanyl is never evenly distributed. One pill might contain a survivable trace, and the very next might contain several times a deadly amount. It turns every single dose into a game of Russian roulette. The result has been a catastrophe with few parallels in modern American history. Overdose deaths, driven by synthetic opioids, climbed to staggering heights, peaking at around 110,000 deaths in a single year. For a time, overdose became the leading cause of death for American adults between 18 and 45, killing more young people than car crashes, than guns, than anything else. Behind that number is an ocean of grief. Hundreds of thousands of empty chairs, parents burying their children. A loss so vast it touches nearly every community in the country. And it's crucial to be clear about who these victims are, because the stereotype is wrong. This is not just a story about people who fit some image of a lifelong addict. A heartbreaking number of fentanyl deaths are teenagers and young adults who took a single pill they bought online or got from a friend, believing it was safe. First-time users, occasional users, curious kids. People in recovery who relapse just once. A person can now die from a single, uninformed decision that a decade ago might have been just a mistake. Addiction is a medical condition, not a moral failing. And fentanyl has made the price of that condition catastrophically final. But it is not all darkness, and this part matters enormously because it saves lives. There is an antidote. It's a medication called naloxone, often known by the brand name Narcan, and it is genuinely miraculous. If someone is overdosing on an opioid, naloxone can reverse it, restoring their breathing within minutes, pulling them back from the edge of death. It's simple to use, usually a nasal spray, and now available without a prescription in many places. A single dose at the right moment is the difference between a funeral and a second chance. If you take nothing else from this, naloxone saves lives and it's worth knowing about. So why can't we simply stop it? Because fentanyl is a fundamentally different enemy. There are no fields of poppies to burn because it needs no plants at all. It's built from industrial chemicals in hidden labs. Its potency means a shipment small enough to hide in a package can supply an entire region. And whenever authorities ban one formula, chemists tweak the molecule to create a legal for now variant. It is cheap, synthetic, tiny, and endlessly adaptable, which is exactly why it has been so agonizingly difficult to stop. Still, people are fighting back, and there is real reason for hope. Naloxone is being distributed more widely than ever, putting the antidote into the hands of families, schools, and communities. Harm reduction tools like fentanyl test strips let people check for the deadly drug before it's too late. Proven medical treatments for addiction are helping people reclaim their lives. And there has been a reckoning for some of those who helped light the fuse. The company and family behind the original marketing have faced enormous lawsuits and public disgrace. Slowly, awareness is spreading, the antidote is spreading, and in some places the tide has begun to turn. The story of fentanyl is one of history's darkest cautionary tales. A reminder that the line between medicine and poison can be as thin as a few specks of powder. Paul Janssen built fentanyl to end suffering, and in hospitals, it still does exactly that every day. But out in the world, it has become something he never intended and could never have imagined. The takeaway isn't fear for its own sake, it's awareness. Know that counterfeit pills are everywhere and can be deadly. Know that naloxone exists and can save a life. And know that the people lost were not statistics, but sons, daughters, and friends, caught by a few invisible grains. If you believe stories like this are worth telling honestly and straight, subscribe. And take care of yourself and each other. See you in the next one.